Hello friends, I'm Dr. Navid Khan. Welcome to my channel. So today we'll be discussing an interesting eponymous or named fracture and assign it a category according to the Salter-Harris classification. But before that, let's have a quick look at the Salter-Harris classification itself. So the Salter-Harris classification is for the physeal fractures in children, and there are 5 categories. The type 1 involves only the physis. Type 2 involves both the physis and the metaphysis. Type 3 involves the physis and epiphysis. Type 4 involves all three, the physis, metaphysis, and the epiphysis. And type 5 is the crush fracture involving all or part of the physis. So this picture I have borrowed it from Radiopedia, and this schematically depicts all the types of Salter-Harris classification. So this one is the normal picture where there is this epiphysis, the metaphysis, and the normal physis or the growth plate in between. In type 1 fracture, we can see the metaphysis and the epiphysis, they remain intact, and there is a separation of the layers of the epiphyseal or the growth plate. So this is the type 1 fracture. And in type 2 fracture, we can see there is involvement of the physis as well as the metaphysis. So in this picture, the fracture line is extending towards the above side, although it is oblique. So this is the type 2 fracture. In type 3 fracture, there is involvement of the physis and it is going on the lower side involving the epiphysis. So this is the type 3 fracture, and the type 4 fracture is passing through everything. Through everything means the metaphysis, the physis, and the epiphysis. And the fifth and the last and the most severe type is the type 5 classification, which is also termed as the ramp lesion, where there is the crushing of the physis or the growth plate. Okay, so let's move on to our case. So this is a Mortise radiograph, and here we can see there is a displaced fracture of the lateral corner of the tibial epiphysis. Okay, there is involvement of the epiphysis as well as the involvement of this part of the physis or the growth, and rest of the physis or the growth plate appears to be normal. So this is the axial CT image from the same patient, and we can see the fracture is involving the anterolateral part of the epiphysis. And when a coronal reformated CT image was obtained in the same patient, we can see the involvement of the epiphysis and the physis, and this part of the physis appears to be unaffected. So as we have seen in the schematic classification, this is going on the lower side. So this is, yes, a Salter-Harris type 3 fracture, which is also termed as the juvenile T-os fracture. Thank you.